South Africa has passed the peak of its Omicron Covid wave with no significant uptick in deaths and will ease some virus restrictions, the government has said. Infection data from the country where the super-mutant strain first emerged in November shows around 10,000 cases are now being reported per day, based on a 7-day average, down from a peak of 24,000 2 weeks ago. Deaths per day have also fallen to around 50, based on a 7-day average, down from 65 a week ago. That figure is less than a tenth of South Africa's 577 peak during January's second wave, despite cases being higher this time around. As a result, the government has announced that an overnight curfew, which confined people to their homes between midnight and 4 a.m., will be lifted. It comes after South Africa also scrapped contact tracing and isolation for close contacts of COVID cases, provided they don't have symptoms. In addition to the curfew ending, alcohol shops will now be able to serve people past 11 p.m., and capacity limits for indoor gatherings will be increased to 1,000 people. However, a mandate requiring face masks to be worn in all indoor and outdoor public places remains in place, and all indoor venues, including supermarkets, bars and restaurants, must adhere to strict social distancing guidelines. If a venue is too small to accommodate 1,000 people within the social distancing guidelines, then capacity must be reduced to ensure adequate space. All indicators suggest the country may have passed the peak of the fourth wave, the South African presidency said on Thursday. Infections dropped by almost 30% last week compared to the preceding 7 days, while hospital admissions also declined in 8 of the 9 provinces. During the spike, only a marginal increase in COVID-19 deaths was noted, it added. While the Omicron variant is highly transmissible, there has been lower rates of hospitalization than in previous waves, the statement said. This means that the country has a spare capacity for admission of patients even for routine health services. South Africa's COVID data is being closely watched by the rest of the world as governments try to get to grips with their own Omicron outbreaks, or else draw up contingency plans for what happens when the variant takes hold. So far, data suggests the mutant strain is far more infectious than Delta, the previous most infectious strain, has the ability to dodge some protection offered by vaccines, as well as reinfecting those who have recovered from a past infection. However, data also suggests infections are milder than Delta, particularly among those who have been vaccinated or recovered, with symptoms being similar to those reported for colds and the flu. The challenge for governments has been to assess whether the increase in infections will overload their health systems based on sheer weight of numbers, even if cases are less severe on average. European leaders have reacted with a mixture of measures, some going into full lockdown, while others have avoided tough measures in favor of booster vaccines to reduce the odds of people getting seriously ill. Omicron was first identified in South Africa and Botswana in late November. It quickly became the dominant strain in South Africa, causing an explosion of infections with a peak by mid-December, according to official statistics. The variant is currently present in more than 100 countries, according to the World Health Organization, and affects vaccinated people as well as those who have already had coronavirus. South Africa has been the hardest hit by coronavirus in Africa, recording more than 3.4 million cases and 91,000 deaths, though that is largely thought to be because its data-gathering systems are far more advanced than neighboring countries. The speed with which the Omicron-driven fourth wave rose, peaked and then declined has been staggering, Fareed Abdullah of the South African Medical Research Council said. Peak in 4 weeks and precipitous decline in another 2, he posted on Twitter. While many Omicron-affected countries are reimposing virus countermeasures, South Africa announced it was reversing course just ahead of New Year's Eve celebrations. Calls for the midnight to 4 a.m. curfew to be lifted had been mounting in the hospitality sector, with owners launching an online petition addressed to President Cyril Ramaphosa. The curfew will be lifted. There will therefore be no restrictions on the hours of movement of people, the presidency's statement said. Alcohol sales would be permitted after 11 p.m. for licensed premises. Mask wearing remains compulsory in public spaces and public gatherings are limited to 1,000 people indoors and 2,000 outdoors. The government continued to stress the need for caution and vaccination, however. The risk of increased infections remains high given the high transmissibility of the Omicron variant, the presidency warned.